Hi guys, my name is Caitlin Cal. I'll be taking you through a presentation on cerebral palsy. I'm sure most of us know a little bit about it, but maybe not the full background story on like how it starts and what to do about it, and so on and so forth. So let's get started. Okay, so cerebral palsy is a congenital disorder. It typically is brought on before birth due to the damage to the immature brain, and it usually happens in the fetus, in the mother. So this disorder affects the movement, body movement, muscle tone, posture, muscle coordination, and it's just usually typically due to like an abnormal brain development, but it can be a cause of a traumatic brain injury, stuff of that nature as well. So treatment can help, however, it's not curable. So you pretty much have it. It's lifelong or less for years and years after you get it. The brain disorder that's associated with the cerebral palsy doesn't change with time. So it typically doesn't get worse, doesn't get better. However, they do say that the muscle shortening and the muscle rigidity may worsen if it's not treated aggressively. So, however, typical symptoms don't normally get worse with age. So here's a list of some symptoms you guys can kind of read through as I kind of quickly go through them. Some exaggerated reflexes, floppy, rigid limbs, so kind of like involuntary motion that goes along with that, an abnormal posture, maybe one arm slightly lifted, and the other's not, some leg differences, some unsteady walking, some people can't walk, some problems swallowing, which is kind of scary. And then they typically have tremors. The excessive drooling and the seizures kind of, I guess, could go together. So cerebral palsy can bring on epilepsy, which is unfortunate. Variations in muscle tone are like a big thing that this disorder is known for. And then lacking that muscle coordination, maybe because the muscle tone is just so varied. Slow writhing movements can be a symptom, as well as delays in motor skills, milestones. That's more targeted toward like infancy and toddlers, which could be early detective of just discovering that maybe your child has cerebral palsy. Favoring one side is big, so maybe if a baby is crawling and learning to walk, maybe the crawling, they start to drag a leg. Walking, they're just having difficulties, or maybe one side can't keep up with the other. Delays in speech and speaking, like just having difficulty speaking is also another symptom, as well as like difficulty with precise movement. So precise being like holding a pen or a pencil or a crayon and coloring. And then abnormal pain in touch perception. So maybe like they don't know if something's kind of aggressive versus calming, or maybe hot from cold. Some effects on the functioning abilities. So if you look at these different pictures, it just really shows a variety of people with this disorder. So you can kind of see the two kids are learning to walk, and the one little kid's his looks a little more aggressive than the other. And then you see this younger guy at the bottom of the screen who kind of appears to be able-bodied, just in a wheelchair. Doesn't really have any like postural components or anything of that nature. And then obviously you can tell the guy up at the top, he's got some postural problems, maybe some muscle tone and things of that nature. Some people that suffer from this disorder can walk, and some people have like a higher intellectual capacity, so there may be higher functioning. Maybe compared this to autism. Some people are very intellectually capable, where others maybe not. So definitely differs to the individual, which will alter your exercise program. Or if you're a physical therapist or occupational therapist dealing with somebody with this disorder, that would definitely alter your programming for them. Say you had all four of these people, you would program drastically different for each one than you would if you just came in with a normal able-bodied person. So other disabilities that come along with this disorder could be epilepsy, like I'd said before, so seizures, some blindness or fully blind, I guess, and same with deafness. So maybe people can't hear or see. Causes of cerebral palsy, typically due to like mutations. Maternal infections are like a big one. Fetal stroke is another big one. Infection as an infant, and then traumatic head injuries, maybe that could come a little later. And then lack of oxygen also goes back to the fetal stroke. So lack of oxygen to the brain could cause the baby to have a stroke and the fetus, and then the baby's born with cerebral palsy. The different maternal infections I'll go over, and then the infant infections I'll go over as well. So maternal health is huge. If you want to reduce the risk of your baby having cerebral palsy, you just have to avoid certain things, or even certain areas of the world. So German measles, cytomegalovirus, herpes, toxoplasmosis, syphilis, exposure to toxins, and the Zika virus. The Zika virus is huge right now. I feel like that's the most talked about in this whole like infections that could increase abnormalities. I know a lot of parents or expecting mothers won't travel and shouldn't travel to certain areas of the world that may expose them to these different infections that they could get, because it's harmful to the baby. And then other conditions that maybe the mother could pass along or could cause cerebral palsy to some extent would be thyroid problems, intellectual disabilities, seizures. So if the mother has epilepsy, the chance the baby has cerebral palsy or epilepsy could be higher. Some of the infant illnesses would be bacterial meningitis, viral encephalitis, and then severe untreated jaundice. So if the baby's born jaundice and it goes untreated, or it's just super severe, that could also be a big factor in what could happen to the baby. Other risk factors, I'll just briefly go through these so I can get to the exercise portion. Breech births, premature births, complicated labor and delivery, low birth weight, which comes along with a lot of other things as well. Multiple babies, so mom is expecting twins or triplets or even more. Maybe there's not enough oxygen to go around, baby has a fetal stroke, cerebral palsy, Rh blood type incompatibility between the mother and child could also be a risk factor for cerebral palsy. So different types. So in this picture, I'll just kind of quickly go through. The dark purple is more of like the totally like impaired body parts. So you see the hemiplegia is more one-sided. So it's more like one upper limb, one lower limb, same side. Where the diplegia is typically both legs or both arms. Just lack of movement. You can't really control them. It's typically involuntary, or no movement at all, like a quadriplegic. I'm sure we've all heard of those, or that term, I should say. You're typically not able to really move at all from the neck down if you're quadriplegic. And then to the other side, we have like lighter purple. So you can see these guys have a little bit more body movement, but still some involuntary movement that goes along with the lack of muscle coordination, the lack of muscle tone. Here's just kind of explaining all of that. So I went over all the plegias, so the paralysis of the one side, where diplegia is two body parts, same upper extremity or lower extremity. Quadriplegic is all four limbs. And then over here on the other side, we have the athoid dyskinetic, so primarily associated with damage to the brain, I guess. For variable movement that is involuntary. Dystonic is slower movements with more muscle rigidity, abnormal postures that like maybe they tense up and then they can relax a little bit afterwards. And then the ataxic isn't really that common, so that's more speech difficulties, oral problems, tremors. I've actually read that they could even get oral diseases. So some treatment. So treatment is available, obviously, but there's no cure to this disorder. So typically, like I said, it's lifelong. I guess it's all really what you make of it, or as a parent with a child that has cerebral palsy, how you go to help them. Physical therapy is usually the first step in treating cerebral palsy. So they would have a specific program to them. You can see in these pictures some of these therapists working with kids and maybe an adolescents up there. And then just a lot of stretching. Stretching will help with the muscle rigidity and the tone and the coordination. Some occupational therapy, because there is a mental component that goes with it. And then that will also help with, like I said, like the precise movement. So kind of like drawing and picking things up and stuff of that nature. Medication is a huge thing. I would probably go to say that most people with cerebral palsy are probably medicated. And then there's also a surgery that goes along with this. So that it's abbreviated SDR, and that means selective dorsal rhizotomy. And what that's doing is it's helping reduce the pain and the spasticity. It's the only surgery that permanently reduces spasticity. So that will definitely help them. I do feel like it's an aggressive approach, though, so maybe not many people go through something like that. You go through different alternatives before you get to that as well. Exercise testing. So I had a really hard time researching testing. I think it's because it's such an individualized disorder. It really varies greatly. So one person could do maybe a full exercise test where somebody might not be able to. I just kind of found a baseline on like statistics on maybe people with cerebral palsy versus an able-bodied person. So they definitely have a lower maximal oxygen consumption, so a lower VO2 max. So that would be taken into consideration when you're programming. And then subnormal values for peak anaerobic power and muscular endurance. And you also have to worry about like what kind of muscular maybe tone problems or coordination problems they have before you take into consideration programming muscular endurance and muscular strength. And then gait abnormalities, so walking is definitely known to be, it takes more energy for somebody with cerebral palsy to walk. So some exercises, I posted up this chart just to kind of go through like muscle and then cardio and flexibility. So exercises are usually geared toward muscle tone. So whether it's like high muscle tone or low muscle tone, you would adjust your programming to that. Water exercise is also great for people with this disorder. And then I would go to say most people might use like a stationary bike or an arm ergometer. Aerobic capacity and endurance can be progressed through exercise done at 40 to 85% of their peak VO2 or heart rate reserve. So 20 to 40 minutes per session, maybe 3 to 5 times a week. I would build up to that, so start off a little slower to see how your client takes to the exercise. Also, it's totally individualized, so this is kind of just baseline for somebody who maybe is a little more able-bodied in this disorder. And then somebody who maybe is not would, like I said, use a stationary bike, arm ergometer. And then best endurance for like maybe cardiovascular would be 6 to 15 minute walks, just walking. Most people can't run or jog. And then or wheelchair pushes. So they're using their upper body to kind of do the work if their lower body can't. And that's twice a week or more often if they're able to. Strength is more free weight based or machine based or even resistance bands. Maybe try 1 set, see how they do, push to 2 to 3, and just progress. Nothing too strenuous. And then flexibility should definitely be prescribed per the ACSM for these guys because muscle tone and the coordination will improve through flexibility and range of motion. Might help them with their tight reflexes and stuff of that nature. Maybe relax a little. So in conclusion, people with cerebral palsy would benefit from any type of physical activity, but especially exercises, using some of that strength and like the muscle endurance exercises, and then just getting them out and interacting also will help them. I mean, it helps anyone. It will definitely help them gain some more confidence, feel a little more comfortable in their skin. Unfortunately, there's not a specific program because, like I said, cerebral palsy varies so greatly that you would just take it individually and progress your person as needed. There are ways to alter the exercise so they can partake in it and they can remain healthy too. And here's some works cited for you guys. All right, see you later.